we managed to run some further tests on the direct contacts of the people who initially tested and on the second generation of contacts. So we did run some 51 tests last night, and we did come up with the results that I'm talking about this morning. We have again isolated 6 positive cases for COVID-19, bringing the total number of cases of COVID-19 that are laboratory confirmed to 35. These are directly related to the cohort that traveled to Pakistan or the contacts, both the first generation contacts and the second generation contacts. 4 of the cases out of these 6 directly linked. A couple who are family friends to members of the said cohort are also part of this group. A domestic worker is also part of this group. A congregant who met with the affected cohort at a religious gathering is also part of this group. Cohort 13 Emirates flights on 18th March 2020. That cohort that traveled to Pakistan. It is important to note that the total number of cases that have now been as a result of local transmission stands at 9 cumulatively. All confirmed cases are in stable condition and in isolation. They will be released once they test negative to COVID-19 and are asymptomatic. The case that we described yesterday as being ill though stable is still admitted to our isolation facility. The condition remains the same. It's not deteriorating or improving. That's what ill but stable means. The patient continues to be monitored by our specialist staff at the Levi Manawasa Medical University. Distinguished ladies and gentlemen, we continue to trace and test all contacts to confirmed cases, and like I said earlier on, we've moved away from the first generation contacts to the second, which means the contacts of the contacts. On the global front, distinguished ladies and gentlemen, 723,279 cases of COVID-19 have been confirmed, with 33,993 deaths, as at 7 a.m. today. In Africa, the number of confirmed cases stand at 5,035, with 153 deaths in 47 countries. It's also important to note that globally, 151,766 individuals have fully recovered from the disease. Distinguished ladies and gentlemen, His Excellency the President of the Republic of Zambia, Dr. Edgar Chagwalungu, continues to monitor the evolution of this epidemic and will continue to provide guidance on the scalable plan that government has put up to ensure that we overcome the COVID-19 outbreak. Having noted the increased evidence of local person-to-person transmission, we have secured more isolation facilities for asymptomatic, stable patients who test positive. These facilities will, by statutory provision, be declared as isolation hospitals, or hospitals where we keep patients for isolation. And these patients will be closely monitored by our staff. We have further reorganized our incident management structures to strengthen response at all levels. We have deployed more surveillance staff in the communities. We have trained more clinical staff, and we have reorganized our various technical teams, including the case management and diagnostic teams, to ensure that we have efficiencies in all the technical groupings. We continue to receive alerts from the public, and we want to appreciate the public for the number of alerts we've gotten, and want to emphasize that for those who we capture through the public alerts, through the ports of entry as high-risk individuals who are coming from COVID-19 high-risk jurisdictions, quarantine is mandatory. The 14-day quarantine is mandatory. By quarantine, we mean putting you in a place of seclusion where you will not be in contact with another person who you could possibly transmit the disease to. This particularly applies to everybody returning home or anybody coming to Zambia. I again refer you to the national address by His Excellency President Lungu, where he made it very clear that we will accommodate people coming in, but subject them to mandatory 14-day quarantine as you are coming from a COVID high-risk jurisdiction. We have noted that a number of jurisdictions have closed their borders, while a number of truckers have gone through our borders and are being cleared at our various borders. The rule of thumb remains that if you're coming from a COVID-19 high-risk country, you as the truck driver and your crew will be quarantined at the ports of entry, and we are in active engagement with the Truckers Association of Zambia and the Ministry of Transport and Communication, where we have introduced a relay system so that other drivers who are COVID-free can take over the trucks and bring them to their destinations. Zambia will not risk introducing into the country individuals from COVID high-risk countries without being certified COVID-free. So the mandatory 14-day quarantine period should be observed in all the border entry points. Countrymen and women, the fact that we have person-to-person transmission should raise alarm. For those of you who are breaching the laws on bars, nightclubs, and casinos, for those of you who continue to hold family engagements where there are more than 5-6 people, social gatherings such as parties, be aware that the evidence of person-to-person transmission then means that in your gathering, there may be 1 or 2 people who will then be transmitting to the rest. And the rest of you become points of transmission wherever you're going back to. So there is no benefit to anyone in defying that. The threat that we must all be alarmed with is the person-to-person transmission, which we've noted. It therefore means that we really need to heighten our compliance to the ban on public gatherings. We'll reiterate again the call for organizations and business houses to ensure no crowding at the workplace or service points, and ensure that only essential services run and that essential staff are available. The Secretary to Cabinet has provided guidance on what this means in the public sector, and let it be emulated in the private sector. This is provided for under the law. In this era of technology, we can allow continuity facilities such as video conferencing, Zoom technology, and so on and so forth. Again, I emphasize, except for the essential workforce providing essential services as guided in the address by the SC, as guided in the SI 21 and 22, as guided in the address by the head of state, Dr. Lungu, please let us ensure that we limit interaction, we avoid overcrowding, we avoid getting into infected places, stay home. All institutions that are providing essential services must ensure that the environment is conducive not to allow transmission. To our workforce in our various hospitals where we're managing these individuals, including those that have been hospitals for isolation purposes, we salute you, and you have our full support, and you are the heroes and heroines of the Zambian people. We value what you're doing. For our cooperating partners, the corporate world that have continued to support this response, we say thank you, and let's continue holding hands to ensure that we defeat COVID-19. As I conclude, I'd like to emphasize the basics. COVID-19 is transmitted through droplet inhalation. It is transmitted by you hands, putting those droplets there, shaking hands, and getting those droplets directly into our airway. It is transmitted by those droplets being on common surfaces and you touching those surfaces and fidgeting with your hands near your mouth and directly introducing into the airway. Let us
News on the go with Diamond TV, powered by MTN.
Fruticana, fruticana.
Oh, yeah, you are the test of a perfect summer. You are my guest at every dinner. You be exciting about them killer. You are the reason now I'm with her. You said ni good to me lily. Life is better with you every day. You are the reason I'm feeling this way. Can nobody take this away? Fruity, fruity, fruity kinda. You're the test of a perfect summer. Cause of you I love no other. Oh na na na. Fruity, fruity, fruity kinda. Why did I have to discover? Because of you I love no other. Oh na na na.
Introducing Fruticana Fruit Juice. Fruticana, find your fruity side. Trade Kings, improving lives.
The holidays are here. Turn your holidays into holidays with our super cool shows. Explore the Wonderland and get lost in the adventure, all from the comfort of your couch. Your friends from your favorite shows are here to entertain you. Great fun awaits these holidays. Go TV, live it, love it.
Touching food before washing after changing diapers. This is tantamount to dangerous cooking. Tawaishiwa tama James ya nomba fipondo. Tayapu alalanga ma James ya kare. Amanda mako tuma James tutachabe pate after pate. That's why Funko Sambila na hygienic soap. Ili na active silver technology wambele. Soap with technology. Officer Papi!
Call police, madam.
Go and hygienics and kurukuta her right now.
You are under Samba in the laws of hygienics.
Hygienic soap is a powerful antibacterial soap with active silver technology formulated to kill 99.9% of germs.
Hygienic soap. You are safe in our hands.
Welcome to MBET Perfect 12 Jackpot. Welcome to our community of fun and lucky winners. Play anytime, only 12 prediction, anywhere, easily on your mobile phone. The only daily jackpot that grows every day.
Hello.
Hello?
This is MBET. Congratulations, and you're a winner today.
Yeah! We love Perfect 12. We are MBET. Get your bonus on www.m-bet.com/ZM. Pay easily with MTN Mobile Money, Airtel Money, and Zamtel Kwacha.
Yeah, I just washed this.
Nalipate fiko ineshifaya fiko etombofe shaboom. Nizonda dotindiye tamene nikondo service saboo. Makes your white much whiter. White school shirts and laundry. Your surface is sparkling brighter. Your number one top stain fighter. Oh yeah, boom. Oh yeah, boom. Introducing Boom Household Bleach. Your new number one bleach specifically formulated to bring out the whitest whites in your laundry. Plus many more uses in your home. Your number one household bleach. Boom Household Bleach.
Trade Kings, improving lives. News on the go with Diamond TV, powered by
Do we have enough test kits, and are we encouraging people to go and test, or it's just voluntary up to now?
Testing is not voluntary. Testing is mandatory if you must be tested. And we say testing is mandatory if you must be tested because we must protect you by ensuring that if you're positive, we put you under appropriate management. By ensuring that we isolate you from possible people you could transmit to, including your family and your neighbors and the rest of the country. So there is an algorithm that governs testing. Like I said, if you're coming in and you're a suspect, we'll not only rely on our physical examination, or rather on the history of the symptoms you're exhibiting, coupled by our physical examination, but our complete investigation involves testing. We have screening tests, we have confirmatory tests. Zambia continues to get support from its partners, the United States government, the Japanese government, the Chinese government, the EU, the World Bank, JACMA, various cooperating partners that have worked with us to support the response, to ensure that we have enough test kits. So in the country today as we speak, there are test kits enough for the response in its current state. And we continue to mobilize more as we engage with our friends and partners in the UN family and the other corporate world that I did allude to earlier.
Next question. Sorry? Please come through quickly. We can't see you. Okay, why don't you speak from there while it's coming?
I can speak from here.
Please, thank you.
Sure. Thank you so much for the update, Honorable Minister. I'd like to find out, isn't it going to be expedient for us as a nation to do house-to-house testing at this particular time, knowing that this particular disease can be had for 2 weeks without the person or the carrier knowing that they have it? We may be talking about 35, maybe we are in 300 or so that we can tell the further spreading or else one day it might be disastrous to us. Thank you.
Well, thank you very much. We have a scientific approach to the response that we have mounted, and we will take into consideration many variables. First of all, we will not do a routine test and treat, but we will be able to define a case. So there is a case definition, and once you meet the criteria for a case definition, then we shall do the test. We will overwhelm the system if we just randomly test. And there is no scientific backing for such an approach. What is indicated is where testing is adequate and is done for all that there is an indication for testing. That is fundamentally important. So I want to assure you that our technical teams, our Zambia National Public Health Institute, working with various partners, have come up with a very robust mechanism to ensure that testing is done when it is appropriate. Efficiencies shall be improved all the time as the new technology or as the new science as new science brings up new ways of testing. For instance, we have test kits now that will bring you results within 45 minutes that are in transit, some within 25 to 30 minutes that are in transit. So you see a lot more people being tested as long as they are contacts or they are meeting the case definition or there is an indication that has scientific backing, for testing. So I do recognize the importance of that question. I do recognize the importance of that question, and basically what it is bringing out is the need for us to ensure that the index of suspicion is heightened and that whenever we need to test, we must test. And I want to assure you that whoever needs to be tested by our definition shall be tested, and we have adequate stocks, and we continue to mobilize more and more stocks. And you will see that testing will now even be decentralized to other provinces. As we speak, when we talk about Lusaka and Copperbelt recording the positives, we're not saying there's no testing in other provinces. All the provinces are sending samples. All the provinces are sending samples through an efficient sample referral system. And we keep sending results back, that are negative. Copperbelt sent us samples, and out of those samples, 2 were positive. We have taken samples from Western, from Eastern Province. We've taken samples from Luapula, from Northern, and the results we give you are results that are positive. Remember that in the current state, we're dealing with a cohort that traveled to a particular jurisdiction, a cohort that traveled to France and a cohort that traveled to Pakistan, and now an individual that has double exposure, having traveled to South Africa, which is recording a number of cases, and also having been exposed to that cohort that traveled from Pakistan.
Okay, the gentleman wanted to ask from here.
Thank you very much, Minister, and thank you very much, Honorable Minister of Information. Indeed, I'm not a journalist, but this is a very important issue that concerns all of us, and this is why I took this opportunity to ask a few questions of my concerns. The number one issue that I want to find out is just relates to what you just spoke about, that you have been collecting samples throughout the country. And I'm wondering how many centers do we have where we are able to test COVID-19? How many centers throughout the country do we have where we are able to test COVID-19? In relation to that, suppose it so happens that all of us who are in here, one of us, or even myself, is symptomatic, and I go and test positive. where do all these who are in here, where do they go? In other ways, I'm saying, where are we sending people to be tested? Because Honorable Minister had an opportunity for the past 3 days to go around health centers here in Lusaka, just here in Lusaka. I've been to Chipata, I've been to Matero, I've also visited our new hospital, Lady Mwanawasa. And what I found out, Honorable Minister, is that on the doors, as you are entering the gates, first of all, you find a lot of people seated, gathered, waiting to go in, especially in the morning, particularly in the high-density areas. You know, you find a lot of people seated, wanting to go in, and they are just seated there waiting. On the gate, there is somebody with water, and they are ushering them in one by one, of course after washing their hands. But that's all they are doing, just washing their hands. When you enter into the where they are supposed to be treated, they are again gathering in a small room, and even with the heat that is there, very stuffed up. The health workers themselves, the clinical officers that are attending to them, they don't have protective clothing. They don't even have the,
Okay, I get the gist of the question. It's how many centers are there, and also the contact tracing. If you had the disease, how would the ministry make sure that each one of us were in contact with you?
No, Minister, when I report, allow my indulgence. This is very important.
I want you to ask a question so we can move on.
A scenario is very important to understand what is going on in the areas so that you answer the question adequately. It's not just about asking a question and then you leave it there. This is the situation that I saw, and it's very serious. So please allow me. So this situation, this is what is happening in the centers. Then, of course, health workers that I spoke to, they are expressing concern in terms of what is this? Protective gear and other facilities. Frankly speaking, I also received few people from other places complaining about this. The other one that I wanted to ask, please, Madam Dora Siria, this is the only opportunity I have. Then in terms of stocks, relating to that, because I'm following up, in terms of stocks at the moment, what are our stocks and what are we importing in case this situation escalates? Because we are closing up the borders, what are our stocks? Handheld, those thermometers, I mean, how come they are not in these centers? I mean, how many do we have? Do we even have them? Thank you very much.
Okay, so I think 4 questions in there. Minister, 4 questions in there. First of all, how many centers for testing do we have generally? Secondly, contact tracing. I think people still don't understand what is contact tracing, because one person can expose so many. How do you ensure that everybody who is in contact with that person? Today we even heard 2nd generation contact tracing. I think those issues need to be explained. That clearly the gentleman wanted to risk his life, and instead of hitting the message of stay at home, he went garavanting the whole Lusaka from hospital to hospital, and that he found some of the health workers complaining that they don't have the sufficient personal gear. And then lastly, stocks. What do we have? How is it coming in?
Well, Mr. Chilushatayali, if you went to a COVID-19 facility, you're in the wrong place. You're exposing all of us here. It means now we're becoming your contact. We don't allow anyone to visit that site because they are contact. In fact, when you visit that site, our workers look like astronauts. So you won't be able to distinguish that. So you might have been to a general facility. Levy Mwanawasa is a huge complex. And Levy Mwanawasa houses a specific unit that is not even accessible by our journalists. And, because it will then expose them and will quarantine them. Let me make this very clear. Where we are managing the cases, we only have positive cases. And those positive cases will transmit to you. And don't dare get there. You can't visit. You can't go take your cameras without us protecting you. And so I want to emphasize here that you have not been to that site. And therefore, you have not been to that site, because we can tell you, we can show you pictures of how that site looks and how people are clad. We are a very responsible government, and at the same time we have a very highly technical team that knows the response from surveillance, prevention to case management. And there is no specialist who allow a health worker to even talk to anyone who is in that facility without putting on a mask, without a gown, without the appropriate thing. So when you just see them, you would know that you're in the situation room. And like I said, I'll repeat, we have at any one time today 50 health workers who you will not see because they are actively managing people. 50. And these are secluded from their families. 2 weeks they are working in a continuous shift. 2 weeks. And when they finish that 2 weeks, they'll spend another 2 weeks in an isolation facility for us to ensure they are asymptomatic and will not transmit when they go home. They are away for a period of a month. That's how much we take serious this issue of contact. So this is not a place where when we do visit that place, we will engage in technology to show what we are doing in there. And if it shall be me visiting, I'll be clad in a manner that you'll only be told that that's the Minister of Health, but you won't be able to recognize me. You know, you'll just be able to see that's the Minister of Health, because I must protect the people that I'll come out and meet thereafter. So I want to emphasize this. Levi Manawasa has routine services in the old wing, and Levi Manawasa has dedicated specialist, highly specialized services in the new wing. And we are actually operationalizing bits and bits as numbers, increase. But for now, we have even identified other places that by statutory provision have declared as hospitals for isolation, where we have the people we have stabilized, and we don't want to send them home, but we'll admit them continuously there under guard and under observation of our staff to ensure that there is no anyone coming in or anyone going out, so that we ensure that we do not transmit. So our staff that are working in those facilities are clad in PPEs. They're very well trained, and they are providing service diligently. We have not recorded mortality yet. We have not recorded any death. And like I said, our 35 patients, save for one, are very stable. Even the one who is said to be ill, like I said, is not deteriorating, but continues to be in the same condition, saturating, well, but when you look at the many variables from a technical perspective, you would describe as somebody who, yes, is ill with comorbidities, other illnesses, and this being just be a superimposition. Yeah. We are adequately stocked in terms of test kits. We are adequately stocked in terms of other materials that we need. But because this is an evolving epidemic, pandemic, numbers swell. Today you have 2 cases, tomorrow you have 40 cases. You will need to continue stockpiling. So our procurements are continuous. We continue to receive materials from our friends and partners from outside, including the corporate world. So at no one point shall we say we have reached the optimum number of things that we need. But all we shall say is, for the current caseload, for the current projections, for what we're doing in terms of surveillance, for what we're doing in terms of case management, for what we're doing in terms of laboratory testing, we have what it takes. And we continue to invest in strategic procurements for strategic commodities to ensure that even as the numbers swell, we are ready and we have commodities that measure up to the projected numbers that swell. We are at 35 today. We may be at higher numbers tomorrow. The number of materials we need, the quantum of materials we need will not remain constant.
Minister, maybe you can truly apply yourself to this and clarify for the public. I think the import of that question has been the challenge with social media and so on, and people not having confidence that what government is doing now is the best practice. What you are doing is what it should be done, is what is being done elsewhere. Maybe, Minister, you can apply yourself to that, because some people are bent on going online and telling people, no, this information is not true. So if it's not from the Minister of Health, who else can be the authority? Maybe apply yourself to that, Minister.
The number of sites where we are testing from the University Virology Laboratory, which is an accredited laboratory internationally, and from the University of Zambia Veterinary Medicine Laboratory, the University of Zambia, the Teaching Hospital Virology Laboratory, and the University of Zambia Veterinary Laboratory. We are still engaging with our partners to see that the gadgets that we have in the provinces, the gene expert machines, that we get appropriate reagents and appropriate gadgets to augment our ability to be able to diagnose or to do the tests in the provinces. However, in addition to that, there is also these new test kits that will not require sophisticated equipment for us to do the testing. So it will be a matter of a week or two at the most. We'll have a different type of test kits. So the sample referral mechanisms will continue for now, but the decentralized testing, where we'll have even capacity to test at every point instead of sending the referral over, the sample over, but we will test right there. The rest of samples, if they come over, is for validation. That also will be something that we'll be doing within the next week or two.
The confidence issue about is the ministry's government doing the right thing, the best practice.
Well, I've always emphasized this. And I'll repeat. The government of His Excellency President Edgar Chagwa Lungu has been doing business differently in the health sector. It's been transforming the health sector. It's been rebuilding the health systems in pursuit of universal health coverage. To do this, there are pillars you anchor on, you focus on. While you are pursuing access to health services for all, you invest in infrastructure to create access. You invest in human capital to provide services. You invest in a supply chain to ensure that all medicines are available for the people. You invest in health security to shield your socio-economic development program from any shocks of epidemics and to protect the public from hazards such as COVID-19 or Ebola. You invest in research. You invest in novel healthcare financing mechanisms. You train human capital at all levels in leadership to ensure that the healthcare is effectively managed at all levels of the health system. These are the fundamentals of the health systems that this government has been pursuing. And there are milestones that have been posted. All these are well enshrined in the National Strategic Plan 2017 to 2021. And this is the chapter on health in the 7th National Development Plan, which is informed by the PF Party Manifesto. So as we speak about what we're talking about today, COVID-19, we're speaking to the fundamental pillar in our health systems called health security. That's the reason why a technical arm was formed called the Zambia National Public Health Institute, just focusing on intelligence and surveillance for diseases, epidemic prevention, epidemic preparedness, research, capacity building for frontline staff, and being able to work with everybody in order to ensure public health security in the region. It must be noted that having lost 11,000 people in West Africa due to Ebola, the African heads of state made a resolution to come up with its own continental health security arm called the Africa Center for Disease Control. and called upon countries to form public health institutes. Zambia scored a first by being one of the first few countries to have formed that, and we've had that as part of our transformation agenda. Furthermore, the Africa Center for Disease Control is structured to provide services in 5 regions. In the SADC region, Zambia is privileged to be the host. So the Zambia National Public Health Institute is not only coordinating health security for Zambia, but for SADC. So what we're doing is international practice. What we're doing is in line with best practices. We have some of the highly trained staff. We have some of the best networks with our colleagues in health security globally, the US Center for Disease Control, the Japanese, the Chinese, the EU, the World Bank, all working together with us to ensure that this is enhanced. So I want you to know that this did not find us at naught. This found us already restructured and ready to address epidemics. This is the same center that triggered the Public Emergency Operating Center that handled the cholera. This is the same center that today protects the country from other hazards such as Ebola, measles, polio, and so on and so forth. It takes a multi-sectoral approach because in a one government approach, one health approach, and in a bid particularly to ensure that we combat one grave global health threat of antimicrobial resistance, we bring all sectors on board, and we have animal health, plant health, and human health convening at this platform. So we want to emphasize that what is being done is structured, is best international practice, and we're not guessing. And today we have an incidence management structure. We have a surveillance system that is taking place nationally, and we have a team that is looking at case management.
Yes, please. Quickly, I know you're all trying to beat your news times for lunch.
Good afternoon, Honorable Ministers. My name is Darius Jonia from Diamond TV. We'd just like to find out from you, Honorable Minister, on the domestic worker that you alluded to, the update that you get. Will you be able to disclose the locality where this particular male domestic worker is coming from, so that maybe people in that particular compound can be able to alert? And another question also is on preparedness. In terms of bed space, what is the maximum bed space has a government prepared? Because here we have seen that now each time you come to give us an update, cases keep on increasing. And my last question is on erratic water supply. Yesterday I was just in George Compound where I interviewed residents, and I could see that their taps were dry. And we are talking about precaution measures. People should be washing hands. How then would they be washing their hands when there's no water? So we want to find out what measures the government has put in place.
Well, thank you very much indeed. We will share all the information that is required to be shared to the public while preserving some basic, principles and ethics, of practice. And what we will say to you here is that a number of these people that will work for particular individuals, some are in-house. Okay, it doesn't mean a domestic worker is coming from a compound. It's not everyone who is a domestic worker comes from a compound. They are living maids. They are living and so on and so forth. So if there is any information that is critical for a particular area, you'll see us going out there, sensitizing, and maybe doing some structural adjustments and so on and so forth. And like so for now, what we are releasing as information is as it is. And we're going to update the nation on any further information, on any further data that links to contact tracing. Remember, the most important thing is not even where such a domestic worker stays. Because if you're a contact, like Chudifetayari is a contact if he went to that place, the most important thing is who he met. And if that person that he met went back to Garden Compound, then we need to follow that person in Garden Compound. If that person went to, Chilenje, we need to follow that person in Chilenje, the person he came into contact with. So contact tracing is what is fundamental. So we will pick up a suspect if you're positive. There's a history that we take, and we go full throttle to examine who you have been in contact with. And so if you are from, somebody wasn't from Luansha, and we had to pick them out from Luansha, and they did our tests from there. You know, so we're able to follow you anywhere. And so we don't want at this stage to say, stigmatize this particular compound, that compound. When it is epidemiologically significant, we will let you know, and we're transparent. Remember, there's a dotting that we do when we're responding to an epidemic to show you where cases are and so on and so forth, and we will be beginning to be that granular as we start getting cases in particular localities.
Best, are we ready?
Like I said, we set aside isolation facilities in different parts of the country, and we have an isolation facility, for instance, in Tubalenge. We have another facility at Levy. The Levy facility can take up to 800 patients. Tubalenge can take up to 12. There are isolation facilities that we have decreed to be hospitals by statutory provision that can take up to 200. I'm talking of Lusaka. If I talk of the Copper Belt, the numbers are different. If I talk of, for instance, just within Ndola, Masaiti rather, we have an isolation facility that can take up to 100 people. If we talk of Chinsali, which is our center for Muchinga, we have a facility that can take up to 300. If we talk of Eastern Province, at Kalindawalo, that facility can take well up to 300. So countrywide, there are facilities that we have identified for isolation. Now, this epidemic will start, this epidemic may swell and involve more numbers. This is the reason why we are ready to ensure we are ready with bed space. We are ready with human capital. This is the reason why we've even started recruiting additional manpower to ensure we reinforce our response and also enhance our readiness. In other words, our scalable response plan will speak to the epidemic as it evolves. The numbers will be different. They'll be low today, high tomorrow. The response will be commensurate.
Maybe we take the last two questions so that you can meet your news deadline.
Thank you, Honorable. My question is, I just want to get some clarity. Is it possible for one to spread or transmit the virus before they show any symptoms, before the 14-day period, the time frame? Say the virus has been in the body for this long and they can't transmit. Just a bit of clarity on that.
Right. And the other question, I'll take them together. Thank you very much. Thank you very much. Was that the last question?
Yes, they have to do the news.
Right. Colleagues, when you are asymptomatic, you can still transmit. This is the reason why when you're positive, we discover you're positive, will still isolate you. Evidence has been adduced to that effect. Initially thought to be statistically insignificant, but we know today that even in the asymptomatic state, you can potentially transmit. Getting granular may not be for this platform, but if you demand so, we may. But two, if you are tested positive, please, you will be confined to our facility. If you are stable to this grade of facility, if you are ill with clinical symptoms and you require support in a clinical setup, to this grade of facility. In other words, to ensure that we do not overwhelm our capacity in our clinical setup, we've set up even facilities where those who are positive but stable are being looked after under the watchful eye of our trained manpower. For our friends who are talking about further measures, I'll repeat, this is a scalable plan. This is a scalable plan, and as evidence is adduced, measures will be escalated. And measures will be escalated. There will be different measures that will be done. You will be informed. So, if you ask me about what measures shall be there, they shall be informed by the evidence we adduce as the pandemic evolves. So this is a scalable plan.
News on the go with Diamond TV, powered by MTN. This coronavirus update was brought to you in association with Hygienics Hygiene Soap, an effective way to fight coronavirus. Hygienics, you're safe in our hands.